Hi, my name is Erin Brownlee. I'm the registered dietitian and certified diabetes educator for the Shoshone-Bannock Tribes Diabetes Project. I have put together a series of videos using the materials from the International Diabetes Center and our tribe to help answer some of the basic questions of diabetes. Let's talk about diabetes in Indian country. Native Americans are 2.4 times more likely to develop diabetes. Education is key to managing diabetes and preventing complications from occurring. In this video, you will learn what diabetes is, what the different types of diabetes are, and symptoms and treatment. To better understand diabetes, it helps to know how your body uses glucose. Glucose is a form of sugar. Many of the foods we eat turn into sugar. Blood takes sugar to all of the cells for energy. Insulin is released from the pancreas to open the cell. Sugar goes into the cell. Once the sugar is inside the cell, your body can use it for energy. In type 2 diabetes, the body cannot use insulin properly. When the insulin goes to open the cell, the door of the cell stays shut. As a result, it is difficult to get sugar into your body's cells, so it stays in your blood. In type 1 diabetes, your body cannot make insulin. As a result, there is no way for your body to get the sugar out of the blood and into the cell on its own. Gestational diabetes occurs in pregnant women. During pregnancy, extra insulin is needed because of hormonal changes. Some women are not able to make enough insulin, which causes the sugar in the blood to rise. Diabetes is diagnosed by measuring the level of sugar in your blood. An A1C test measures your average blood sugar level over the last 2 to 3 months. A fasting glucose test measures your blood sugar level when you have not had anything to eat or drink for at least 8 hours. A random glucose test measures your blood sugar level at any time of day. An oral glucose tolerance test measures your blood sugar level when you've had nothing to eat or drink for at least 8 hours. Then it measures your blood sugar level again 2 hours after you drink a sweetened beverage. A1C is a laboratory test that shows your average blood sugar level over the course of 2 to 3 months. It measures the amount of sugar stuck to your hemoglobin. Hemoglobin is the part of your red blood cell that carries oxygen to your body's tissues. When blood sugars are high, more sugar sticks to your hemoglobin. The A1C target for most people with diabetes is less than 7%. When at least half or 50% of your blood sugar test results are in target, your A1C usually will be in target too. Some people with type 2 diabetes may have symptoms. However, some will have no symptoms and find it hard to believe the diagnosis. Some of the common symptoms for diabetes include increased thirst, frequent urination, blurred vision, unexplained weight loss, increased hunger, fatigue, mood changes, dry itchy skin, cuts or sores that don't heal, infections, numbness and tingling in hands, feet, or legs. Most symptoms go away with treatment. In fact, it is only after they are gone that many people recognize they had symptoms in the first place. The goals of diabetes treatment are to help you keep your blood sugar levels in target, keep your blood pressure and cholesterol levels in target, balance your diabetes care plan with your daily life, prevent, delay, or slow progression of health problems caused by diabetes, and to feel better every day. The best care plan for you is the one that keeps your blood sugar levels at goal. A meal plan. Making healthy food choices are important to keep blood sugars in target. Many of the foods that we eat turn into sugar in the body. It is important to eat consistent meals and monitor portion size to ensure blood sugars are staying at goal range. Activity plan. An activity plan helps control blood sugars in several ways. Increased physical activity burns extra energy and calories. As a result, this will assist with weight loss or weight maintenance. Increased physical activity will also decrease insulin resistance. Stress management plan. Identifying stressors in your life and finding ways to healthily cope with them is important to maintain blood sugar targets. A medication plan. Knowing what medications you're on, the doses your doctor has prescribed, ensuring that you're taking them correctly, and knowing what other treatment options are available will help with maintaining optimal blood sugar targets. There are different types of diabetes medications. Some of these include pills, non-insulin injectable medications, and insulin. The medications that may be prescribed by your healthcare provider are to help your body control your diabetes and supplement what your body is unable to do. It is important to work with your healthcare provider to discuss the best treatment plan for you. As a result, it is vital to know what your daily blood sugars are, what your A1C is, and other labs so that you and your provider may better evaluate when it is time to change the treatment plan. Keeping your blood sugar levels in target will help you to better manage your diabetes. Before you can aim for a target, it is important to know what your target is. Before a meal, your blood sugar should be between 70 and 130. 1 to 2 hours after the start of your meal, you want your blood sugars to be less than 180. Your blood sugar level naturally goes up after you eat. This is why it is important to allow your body 2 hours after a meal to fully process the food you ate. Check your results against your targets. Sometimes these numbers will be out of target. Work toward having at least half or 50% of all of your test results in target. Goals to consider at this time include monitor and record blood sugars, take your medications regularly, and evaluate your stress level. For further information regarding any of the topics we have covered in this video, please contact the Shoshone-Bannock Tribes Diabetes Project for an appointment.